Healthcare is one of the most important decisions anyone can make, and after a challenging year, a new study shows that nearly half American workers purchased at least one health benefit in response to the COVID-19 pandemic. Joining us is one of the top wealth experts who is named the Wealth Whisperer, Winnie Sun, to help us learn why choosing the right healthcare plan can help us financially in a healthy way. So good morning, Winnie. How are you?
Good morning, Brad. I'm so happy to be here with you.
So I'm so happy to have the Wealth Whisperer with us because right now is a time for us to look at our healthcare plans, but also look at our financial plans so we do stay healthy, right?
Absolutely. This is what we need to do.
So why is choosing the right healthcare plan so important?
Well, we know that healthcare costs are becoming a greater portion of a household's budget. So for many of us, this is open enrollment season. We're going to be making decisions on things like insurance premiums and deductibles and out-of-pocket expenses. And unfortunately, these costs are even more expensive than many of us realize. And with the pandemic, we're looking more carefully at these costs, seeing where we need to save or spend more. In fact, the recent 2021 Aflac WorkForces Report showed that almost half of employees surveyed said that $1,000 would be the max that they could pay for out-of-pocket medical expenses, and a similar number said that they couldn't exceed a month without a paycheck. So we have a lot to think about.
Yeah, wow, it's amazing. All right, what are some other top highlights from this study?
Well, Brad, one that I found really exciting, and I think you're going to like to hear this, is that nearly half of those surveys said that they purchased at least one more new health benefit in response to COVID-19. But most importantly, why that's positive is that they're thinking ahead. They're being proactive in their planning. They added things like life insurance and critical illness, a hospital indemnity plan, telehealth services, or mental health resources. In fact, 90% surveyed believed in the need for these supplemental benefits, like the ones that Aflac offers, that are designed to pay employees cash to cover their health insurance, what their health insurance doesn't. So they're really being proactive in planning.
So let me ask you this. Why is this new finding so important right now?
Well, we know your company's open enrollment time is one of the most important times of the year because you get to review and update your benefits. This is a time where you want to make sure you had the coverage you need if or when or someone in your family gets sick. So things happen when we least expect them to. So planning is really key. Hospital and doctor bills can devastate a family's finances. So planning ahead is important. So right now, take the time to do that.
And of course, the impact of choosing the right health care is such a big decision. How does this cost affect us?
Well, that's a good question. Many of us still underestimate the cost of healthcare. The Aflac survey found that more than a quarter, about 27% of employees have faced a major medical event in the past year, either themselves or a family member, and a whopping 88% have faced unexpected costs, mostly related to medical costs, such as a hospital, doctor, even medication bills. And since many of these costs were not covered by health insurance, 1 in 3 Americans surveyed said that they had to make financial sacrifices, such as delay buying a car or a home, or even starting a family or getting married.
Okay, let me ask you this about employers. Are they starting to address their employees' health care needs?
Well, that's a big question. So we know that so many businesses have also been impacted by the pandemic. However, many companies still plan to maintain the same existing health insurance coverage. They're thinking that this is what their employees want. But studies actually show that 75% of employers believe that their workers are happy with their benefits package, but actually only 61% are. And so more than half of American workers share that they value supplemental insurance, like critical illness and hospital, cancer policies, as they like these options. They want to have these options as part of a comprehensive benefits package. So the good news is that if employers offer these options and employees then enroll in the right combination of healthcare and supplemental policies, that they feel better protected, it relieves their stress, and they feel more valued, which is a win-win for both the company and their employees.
Yeah. Winnie, we got to wrap it up here, but I do want to talk about one theme, and that is, of course, workers experiencing stress with the finances and work and their health. Did Aflac, of course, address this theme?
They did. You know, you've heard me say this, health is wealth, and I think we all know that. And so it's key to deal with this head on. We know that healthcare is an anxiety measure, but if we get more productive, more proactive in our planning, this can help reduce that stress. So this is a time to do your homework, better understand your health insurance options. You know, definitely visit aflac.com, learn more there. So just follow me on Twitter at Winnie Sun, and we'll talk some more.
I like that. Well, I'll tell you, it's nice to have the Wealth Whisperer on our show. So, Winnie, thank you very much for joining us.
Thank you, Brad, for having me.